Ladies, amendment is in order and may proceed to speak to the amendment and the bill.
Thank you, Mr. Speaker. And ladies and gentlemen of the House, I want to alert you to a problem because Ohio has a problem with infant mortality. Infant mortality is defined as the death of a child before they reach their first birthday. In 2012, there were over 1,000 babies that died before they ever reached their first birthday. At 7.7 per 1,000 live births, Ohio ranks at the bottom of the pack, 47th out of 50th in this nation. To make matters worse, the state of Ohio ranks 50th out of 50 in infant mortality for African American babies. What kind of message are we sending with these infant mortality rates so high? The executive budget removes two important provisions, one of which would be very instrumental in reducing our infant mortality numbers. The Medicaid Optional program that allows women up to 200% of the federal poverty level to receive prenatal care is one of those provisions. The other is a provision that would allow women up to 200% of the federal poverty level to receive breast and cervical cancer treatment. Again, these are women who have cancer. They are being eliminated out of this budget with no other way to receive medical treatment for their cancer. Infant mortality is a specific indication of health. It's the death of a baby before they reach their first birthday. But it also serves as an indicator of the overall health of a community. Oftentimes, we know that businesses and associations and organizations want to know what the health of a community is before they get there. And a very easy way to figure that information out is to look at the infant mortality data. That number tells you a lot about that community. It tells you about the access to education. It tells you about poverty rates. It tells you about job employment. It tells you about toxic stress. And as you can tell, with 47 out of 50th and 50 out of 50, Ohio is not doing a good job at all. But to these business people and potential investors of this state, what incentive would they have to come invest here? They're presumably going to be getting an unhealthy and unproductive workforce. That puts us at not only a health disadvantage, but an economic disadvantage. Any physician who practices family medicine, obstetrics, or gynecology, they all agree that two of the best ways to reduce infant mortality is to prevent low birth weight and premature birth. These are the number 1 and 2 contributors to infant mortality. Furthermore, the number 1 way in which prematurity and low birth weight can be reduced is to make sure that women receive early prenatal care and that prenatal care continues throughout their pregnancy. Many low-income women do not receive prenatal care, and it's not because they don't care about their babies, but it's simply because they can't afford it. Existing law, which allows women up to 200% of the federal poverty level to obtain prenatal care through the Medicaid program, helped combat this disparity. 200% of the federal poverty level is just over an income of $23,000 a year, something like $11.33 an hour. Not a lot of money. I think we can all agree on that. But these women and these babies deserve the best chance at a healthy life, and having a low income should not preclude them of that opportunity. I've heard many arguments over the few months about these particular provisions of the bill. I've heard that these women should be on the health exchanges. That's why we have them. And honestly, this is just a way that's going to punish the women for being low income. But really, the person that we're going to be punishing is that woman's child. The child that does not receive the benefits of prenatal care. In addition to that child having to suffer unimaginable consequences, the taxpayers still have to pay for the health care costs of these women and these babies, often who are born early and spend several months in the neonatal intensive care units. These visits cost upwards of hundreds of thousands, sometimes millions of dollars to care for these tiny premature babies. One of the other concerns I've heard about this bill is that we'll just be promoting more women and more people to be on Medicaid longer than they ever should be. But the really great thing about my amendment is that it will specifically eliminate this particular program when Ohio reaches 6.0 out of 1,000 live births as an infant mortality rate. Now that number, it comes from Healthy People 2020. It's an initiative to make sure all states across this country are healthy. And Healthy People 2020 suggests a 6.0 infant mortality rate. That would put Ohio in the middle of the pack. Still not great, but much better than 47th out of 50. And while the federal government could have closed the loophole by allowing pregnancy to be a qualifying event to allow coverage, they didn't. And just in case you're not familiar with that, there are certain life events that occur, like births, marriages, that allow people to join insurance programs, including the health insurance exchanges. But a woman being pregnant is not one of those events. So, say for example, a woman gets pregnant in February. She'll deliver by November. She has no opportunity to join the healthcare exchanges. It does not benefit her. Now, I do wish that there could have been movement on that, but there wasn't. But it would be both derelict and negligent for this state to just throw our hands up in the air and say, that was the federal government's problem. It's not ours. It is our problem. And finally, as I start to close, I just want to comment that I've noticed that many of our colleagues here in the General Assembly have been wearing these little gold and silver lapel pins. These pins known as the precious feet of the unborn. And they're supposed to be an exact replica of the feet of a 10-week-old fetus. And it serves as a reminder to protect human life at all stages. At 10 weeks gestation, physicians recommend a woman receives her first prenatal visit. This visit is designed to help protect that fetus's life. At this appointment, the first set of prenatal vitamins are prescribed. The doctor goes over a medical history and pre-existing conditions to identify any potential complications or problems that may arise that they need to start planning for. And also at this 10-week visit, the woman will have her first ultrasound. And at the ultrasound, you'll see the size of the baby. You'll see that it's starting to form features like a jawbone. The fingers are no longer webbed. And at this critical stage and at this appointment, a woman will hear her baby's heartbeat for the first time. Now, I know you all remember just last month, we stood on this floor and debated heartbeats, the fetal heartbeat, the point at which so many of our colleagues said we needed to protect human life. We have the opportunity to do that by making sure that women, low-income women especially, have access to prenatal care. So, to my colleagues and ladies and gentlemen of the House, here's your chance to protect human life at all stages. Early prenatal care protects human life at all stages, and all women, even women of meager and low incomes, especially these women, deserve to have the chance to have healthy babies. My amendment will protect human life at all stages, and it will promote the most positive and economic birth outcomes. I call that a win-win. And as I close, I just want to remind you that a vote to table this amendment or a vote not to reinstate this life-protecting measure is not a vote against me. It's not a vote against my caucus. It's not a vote against the federal government. It's not a vote against the president or Obamacare. But I'll tell you what it is a vote against. It's a vote against the babies who never make it to their first birthday. It's a vote against the babies in my district where infant mortality is twice the rate of the state average, and most of them are African American. It's a vote against the mothers who cry themselves to sleep because they do not have a child to hold, and their child will never reach their potential because they died before their first birthday. A vote against this bill is a vote against protecting life at all stages and the spirit of the precious feet of the unborn lapel pins that you also proudly wear and many of you continue to wear. So I urge all of the members of the House of Representatives to support this amendment, to support life, and to support the babies of this state.